Yeah, hey, going everyone. Very good to see you all. Okay, so what are we looking at today? Today we want to look at consulting the correct way. What do I mean by consulting the correct way? Well, you know, there are many methods of healing, and what we should recognize is that unless we're getting to unless we are addressing the very core issue of your illness, there will never ever be any recovery. So today I want to go through 4 processes that you should consider in regards to repairing your health, in regards to recovery from either an acute sickness or a chronic illness. So what do I mean by an acute illness? Well, an acute illness is something which is inflammatory. It's where basically you've got a lot of hormones in your body that are creating this prostaglandin inflammatory cycle in your body, PGE1 or PGE3. So these are the various inflammatory cycles that you need to avoid. And so we want to cover some of the issues in relation to the prostaglandin issue. So let's talk about step number 1. Step number 1 is recognizing intelligent wellness consultations. Intelligent wellness. What do I mean by intelligent wellness? Well, basically, intelligent wellness is something that you already know about, right? Okay, so everyone is intelligent in regards to their health. We all understand when we're sick, and we know what to do, right? What's the first thing that you see animals do when they're sick? Yeah, they don't eat. They cease eating. They fast. So this is a innate. This is a innate cycle. It's innate in all of us. Innate means innate means it's built within. Okay, you have a psychometric response that helps your body to make a decision in regards to your own personal health. So intelligent wellness consultation would naturally include your own innate experience. You know what to do. Some people don't, but in general, we know that that when we're ill, we need to drink lots of water. We need to rest. You know, we need to avoid putting anything in our gut. I mean, whoever wants to smoke a cigarette or drink a cup of coffee or drink some fizzy drink, you know, or have a solid meal when you're feeling unwell. So we have an innate experience within us all that will exempt certain foods when we're not feeling well. So a wellness consultation is something that involves identifying, examining what is happening in the human body. There are many instances related to various symptoms. It could be hormonal, it could be viral, it could be bacterial, it could be emotional. So it's essential that you identify, that you address, that you pinpoint exactly what is happening in the body. And of course, there are certain symptoms that you will express. There are certain symptoms that you will express when you're not feeling crash hot, yeah? So, of course, some of the options that you should consider in regard to a wellness consultation is herbal extracts, okay? That's very important for you to recognize, and that is that pharmaceutical drug medication does not heal the underlying biochemical imbalance in the body. So it's essential that you identify, okay, or rather it's essential that you choose specific herbal extracts, fluid extracts, whether that be fluid extract of 1:1 or a fluid extract of 1:2. I'm talking about a ratio. I'm talking about a ratio of actives within the phytochemical extract that the medical herbalist has prescribed to you. Yeah, so there are certain herbal extract preparations that that you should be, or rather that your medical herbalist should address. So there are certain herbal applications. They might be an alkali oil, they might be a bitter, they might be you know, these are the plants that contain specific chemical constituents that activate or rather that stop apoptosis, cell death. So we're talking about apoptosis. We're talking about a disturbance within the very circulatory system, the digestive system. Primarily, you will find that it is the digestive system that is related to a lot of your discomfort and a lot of your problems. So we want to address specific herbs, and of course, the medical herbalist would be able to identify that approach. Now, also printed materials. Obvious, you're going to need instruction. You're going to need printed materials. You're going to need instructions that you can pin on the refrigerator. You can read step by step by step, and you will know either from a daily basis or from an instructional basis exactly what needs to be done in relation for you to recover. Of course, there are also various dietetic approaches as well. Okay, so it might be an Ayurvedic process that is looking at the kapha and the vata and the pitta. Okay, there are certain constitutional body types that may be related to. I'm talking about Indian Ayurvedic medicine here, but I'm specifically talking about the philosophical approach of you know, whether you're going to eat solid food, whether you're going to eat a food that is okay. You understand the elements, yeah? Water, fire, sky, and earth. Yeah, they're the four elements, and there are certain foods that typify those four elements, and so maybe maybe your nutritional dietitian or your nutritional biochemist, he will approach that for you. He will address that within the consultation. In general, it may be you may have a gluten sensitivity. Yeah, you may not be able to digest protein because of gluten. So that's essential that you address that issue. You know, it could be a fungus problem as well. You may have a lot of fungus within the gut lumen. So it's essential that that you address that as well. Okay, so that's basically it today for my first live presentation on Facebook. Yeah, so you can see Ackerman alignment. If you go to the story of our page, please contact us if you are in professional consultation regarding nutritional dietetics, regarding phytomedicine, regarding musculoskeletal issues as well. I'll be back tomorrow to discuss with you section 2 on step 2, which will be our diagnostic health evaluation. I'll go through a number of options that you should consider in relation to what particular diagnosis path you should follow to identify the underlying cause of your discomfort. Yeah, so that's it today. Cheerio. Have a nice day. Over and out. Bye-bye.